and welcome to Tech Talks, the People and Planet podcast, where we explore the ways that technology can be used for good, from healthcare to education, social justice to sustainability, and everything in between. We're really going to be looking at trying to cover it all. I'm delighted to welcome our first ever guest, Phillipp Kurtz. Phillipp is the CEO and co-founder of Famedly. Famedly is a real-time decentralized messaging service for healthcare professionals. In this episode, we'll be discussing the impact of decentralized messaging on the healthcare industry and how Famedly is making communication more accessible and efficient for medical staff. So join us as we dive into this exciting intersection of technology and social impact with our guest, Phillipp Kurtz. So Phillipp, really keen to get stuck into all things Famedly. But first, as I say, pleasure to have you. It'd be great to hear an introduction from yourself and a bit of a brief overview of what you're doing at Famedly.
Yeah, hi Tony. Thanks for having me. I'm really excited to be the first guest on the show, so really looking forward for talk. Yeah, what can I say about myself? I'm a medical doctor. I studied medicine in Frankfurt, Germany. And then soon I realized that the processes in the hospitals, especially around communication, are quite bad still. They use the fax machine still a lot. They send each other letters really with patient information. Everything takes ages. And it takes a lot of time for doctors to get all the information they need. And that kind of inspired me, together with my co-founder, to found Famedly, which is now basically a messaging solution for healthcare. The cool thing about it is that we are actually able to help doctors and nurses and therapists communicate easier, and that's probably the most important part, more secure with each other.
Cool. So what was, I mean, obviously, you know, as you mentioned there, that it's quite old school, I guess, in a sense, if they're kind of sort of still using, you know, fax machines and things like that. So obviously that was kind of sort of around the inspiration of what pushed you to kind of sort of create something more modernized and sort of disrupt that sector within healthcare. So just for people that are listening and you know may not quite understand, what does it mean to have a decentralized system, and how does that kind of sort of differ from other messaging apps like WhatsApp or Signal, for example?
Yeah, so in healthcare, of course, healthcare data is very sensitive, and so you need to protect it very well. And the issue with WhatsApp and Signal and other messaging solutions is everything goes over one central server. So especially regarding metadata, they can do a lot of analyses on those. And the good thing about a decentralized network is that all institutions that are part of the decentralized network have full sovereignty over their data. So it's not so they can host their server themselves, basically, if they want, wherever they want, and can control who's getting on their server, who's not getting on the server, and then we have the possibility to also steer communication in the right direction. Only some of the decentralized nodes can talk to each other to make sure that data is not shared with the wrong people, basically. And it's a lot easier or a lot better to do with a decentralized service.
Okay, no, cool. And I guess it'd be good to kind of understand a bit more around the sort of specific technology then, I guess, behind the platform, you know, in terms of the tech stack and how that actually allows for secure real-time communication, essentially.
Yeah, maybe some of the listeners actually already heard about the Matrix protocol, which is basically a British protocol. It was invented by people from London, and what it does is it makes, or the protocol describes how messages can be sent end-to-end encrypted over a decentralized system. So from your smartphone to the laptop or something, web app, you can send end-to-end encrypted messages, and that not over one server, but over many servers. And group call, you can have group conversations over many servers. And basically, what we're doing, we're taking the reference implementation from Element, which is the company that invented the Matrix protocol, and we're building services around it. So Synapse, which is the server from Element, is written in Python, but all the add-ons that we develop server side are written in Rust, which is a cool emerging language, and everything that we develop for client side is written in Flutter and Dart, which is also quite a cool Google framework recently invented. And yeah, that's basically the tech stack that we're using. The good thing about it is that, the components that we build in Rust server side allow us to integrate our server or service better into existing primary systems like health, electronic health records and stuff like this.
Cool. And was that kind of a conscious choice to choose that particular tech stack, and what were the kind of sort of core reasons behind that, if so?
Yeah, for us it was important that people like working with the tech stack, and we talked with people in the community around the Matrix protocol, and we got a lot of positive feedback about these languages that we're now using, and so that's basically important for us, and I think it's also future-proof because they're rapidly evolving, the frameworks, the languages that we're using. They're quite well supported and are growing. The communities around it are growing. They are open source, so that's the things that were important for us there. Yeah,
cool. And I'm sure that enables the ability to sort of scale as well quite effectively, I'm sure. So what sort of specific challenges did you kind of sort of face when choosing or implementing that tech stack, and how did you kind of sort of overcome them?
Yeah, one of the major challenges was, for example, while implementing the Matrix protocol, it was around end-to-end encryption, because if you want a real end-to-end encryption, then it's not always user-friendly. And so we had to do a lot of user testing, a lot of design thinking workshops, a lot of just a lot of communication with our users. And in the end, we managed to find a good way to balance data security and usability. So we have a real end-to-end encryption, and we have the possibility to use it on different devices, and only if in specific situations the user really needs to do all the stuff that's necessary. But if you're just using it on the phone, it's as easy as using WhatsApp, and that's, I think, the best thing that we managed to find a way to get to make this possible.
Of course, absolutely. And I guess from kind of a more of a from more an angle in terms of what you're kind of sort of trying to achieve on that, what sort of measures have kind of sort of been taken to ensure that the privacy and the sensitivity of patient information is there, and how do these kind of sort of measures, I guess, compare to the traditional sort of centralized communication services that ones like we may have mentioned before?
Yeah, so one of the most important things, definitely the data sovereignty that I mentioned before, which is definitely the biggest difference between our system and the centralized systems out there. But also, and that's probably another thing, is that we only let users into the, so it's basically a closed network where we only let users in that are verified by their employer, by hospitals, by doctors' offices and stuff like this, which is also very important. Then, of course, a lot of stuff that we're doing around making the operating system secure, like hardening it. So we follow all of the guidelines by the German regulatory authorities to make it as secure as possible. And of course, the end-to-end encryption is very important for patient data as well. But also, we always, in Germany, we talk about data privacy a lot and not so much about data security. To make data also available and make it secure, we also have the possibility to bring important information outside of the system and store it on a long-term archiving solution to make it accessible for the hospital, especially if there's a legal case around a patient or something, so that they can access it in those kind of trials, and make it available as well, like outside of the end-to-end encrypted environment.
Absolutely, no, absolutely, it makes total sense. And I think from that standpoint, then, I mean, what kind of overall sort of impact do you kind of want this to have on the healthcare industry, and kind of sort of how far do you think that could go, and how do you kind of sort of potentially see that evolving in the future?
I think the most important thing, and now I need to maybe make a little detour here, because we don't only have the messaging solution, but like I said, we have add-on components, and the most important add-on component is our workflow engine. And the workflow engine is connected to a FHIR server. FHIR is like a data standard for healthcare. And this allows us to create workflows that react to changes in the patient case, for example. So let's say a new lab result comes into the primary system, and some of the values are too high or too low, or whatever. We want to notify all the people that work with the patient. So we can send push notifications because we can realize the changes in our workflow engine, and then trigger push notifications to doctors, to the nurses, and say, hey, look at the patient, something's not right there. And basically have those kind of trigger points to integrate or use the messenger as a tool to support patient care, and to actually help the doctors and nurses be better at their job, like get to know faster about things that change and stuff like this.
Yeah, I can certainly see how that would, drive more efficiencies within that space as well. So that's really, really great to hear. So what are I guess for yourself, what are the sort of next steps for the business? Is there anything kind of up and coming, any new exciting kind of projects, and how do you kind of sort of plan to continue innovating in that sort of field of decentralized communication, essentially?
So what we're working on at the moment is really building everything around those FHIR APIs. So it's a standard that's emerging quite fast at the moment in the healthcare space, and we're building a lot of stuff around it to be able to get integrations, or make the integrations even deeper, to come nearer to the patient journey. Also include the patient. That's basically because at the moment we're aiming at doctors and nurses or healthcare professionals at the moment, but we also want to include the patient, and that's one of the most important things that we're working at the moment. Are looking to innovate more to get from a healthcare professional centered care to a more patient-centered care. I think that if done correctly, a communication tool like ours can be a very good tool to support that.
Absolutely. That's brilliant. Well, look, I mean, I'm really excited to continue watching your journey. I think that's probably roughly kind of all we've got sort of time for today. But look, Philip, it's been absolutely brilliant speaking to you. And as I say, I'm really excited to see how your journey continues with Famedly. So yeah, everyone, thank you for listening to this episode of Tech Talks, the People and Planet podcast. We really hope that you enjoyed the discussion here with Philip. the CEO and co-founder of Famedly. Go check them out on the topic of decentralized messaging and its impact on healthcare communication. At Tech Talks, we believe that technology really has the power to create a positive change in the world. By bringing together experts, innovators in the tech industry, we really aim to explore the ways that technology can be used for good. So if you have enjoyed this episode, please consider liking, sharing, commenting on our podcast. You know, the feedback is valuable to us as we aim to continue to bring more conversations on technology and social impact. So thanks again for listening. We look forward to bringing you more inspiring guests and thought-provoking discussions in the future. And Philip, once again, thank you so much for your time. It's been a pleasure.
Thank you, Tony.
Thanks a lot.